This device is a small, flexible product that is inserted into the uterus to prevent pregnancy. It is used by individuals seeking a long-term, reversible method of birth control, lasting up to 10 years. This device does not protect against sexually transmitted diseases, such as HIV, gonorrhea, and chlamydia. Before using Paragard T380A 380 square mm intrauterine devices, Iuds, make sure to read the patient information leaflet provided by your pharmacist. This device is inserted into your uterus by a healthcare provider and can stay in place for up to 10 years. After insertion, you should schedule a follow-up visit after your first menstrual period to ensure it is properly positioned. It's important to check the position of the device once a month to make sure it hasn't moved. If it comes out or you can't feel the threads, contact your doctor and use backup birth control. If you want to continue using this method after 10 years, the device should be removed and replaced with a new one. Your healthcare provider can remove the device whenever you decide to stop using it. After the placement of the Paragard T380A 380 square mm intrauterine device, you may experience temporary pain, bleeding, or dizziness. Your periods may become heavier and longer, and you may also experience frequent vaginal bleeding between periods. If these effects persist or worsen, it's important to inform your doctor. It's essential to remember that this device has been prescribed to you because the benefit outweighs the risk of side effects. However, it's important to note that using an intrauterine device, IUD, may increase your risk for pelvic inflammatory disease, PID, especially if you have had multiple sexual partners or a sexually transmitted disease in the past. Symptoms of PID include unexplained fever/chills, lower abdominal/pelvic pain, pain during sexual intercourse, genital sores, and unusual vaginal discharge. If you experience any of these symptoms, it's crucial to inform your doctor promptly. Additionally, while rare, a serious allergic reaction to this device is possible. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. Finally, it's important to note that this is not a complete list of possible side effects, and it's essential to contact your doctor or pharmacist if you notice any other effects not listed. If you are in the US, report any side effects to the FDA, and if you are in Canada, report them to Health Canada. Before using Paragard T380A, make sure to inform your doctor or pharmacist if you have any allergies, especially to copper, or if you have any medical history of recent pregnancy, current breastfeeding, cancer, unexplained vaginal bleeding, uterus problems, Wilson's disease, or conditions that weaken the immune system. If you or your partner have other sexual partners, this device may not be the best birth control method for you. If you or your partners get a sexually transmitted disease, contact your doctor right away and ask if you should continue to use this device for birth control. Before having surgery or a medical procedure using heat therapy or an MRI test, inform your healthcare provider and testing personnel that you are using this device, as your procedure or MRI test may need to be adjusted. This device should not be used during pregnancy, and if you become pregnant or think you may be pregnant, tell your doctor right away. It is unknown if the copper in this device passes into breast milk, so consult your doctor before breastfeeding. When using Paragard T380A 380 square mm intrauterine devices, Iuds, it is important to be aware of potential drug interactions that could affect its effectiveness or increase the risk of side effects. It's important to keep a list of all the medications and products you are using, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. You should not make any changes to your medication dosage without consulting your doctor first. If the Paragard T380A 380 square mm intrauterine device is accidentally swallowed, it can be harmful. If serious symptoms such as passing out or trouble breathing occur, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. Make sure to attend all of your scheduled medical appointments and checkups. It's important to have regular physical exams, which include pelvic exams and screenings for cervical cancer, such as Pap smears. If you have any questions, be sure to consult your doctor for more information. The Paragard T380A is a type of intrauterine device, IUD, that is used to prevent pregnancy. It is a small, T-shaped device that is inserted into the uterus by a healthcare professional. The Paragard T380A works by releasing copper into the uterus, which creates an environment that is toxic to sperm and eggs, preventing fertilization. The Paragard T380A is a long-acting form of birth control that can last for up to 10 years. It is a non-hormonal method of birth control, which means it does not contain any hormones. This makes it a good option for women who are unable to use hormonal birth control methods. One of the main benefits of the Paragard T380A is that it is highly effective at preventing pregnancy, with a success rate of over 99%. It is also reversible, meaning that it can be removed at any time if a woman decides she wants to become pregnant. The Paragard T380A does not require any daily dosage or specific timing for it to be effective. Once it is inserted, it works continuously to prevent pregnancy. However, it is important to have it checked by a healthcare professional regularly to ensure it is still in place and functioning correctly. Overall, the Paragard T380A is a safe and effective form of birth control for women who are looking for a long-term, non-hormonal option. When using Paragard T380A 380 square mm intrauterine devices, Iuds, it's important to store them at room temperature. Keep them away from children and pets to prevent any accidental ingestion. When it comes to disposing of the product, do not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of it. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.